What happens when you take someone off of life support in an ICU? Life support is a term that can encompass many medical therapies, but most often it refers to modes of oxygen delivery, like a ventilator or a BiPAP machine. Here is what you can expect. The patient is made a DNR if they are not already, and a special armband will be placed on them to denote that CPR is not to be done on this person. The patient is next given IV medications that suppress pain, anxiety, and any possible feeling of suffocation known as air hunger. Some people remain somewhat awake once this medication is given, but the majority of them will fall asleep. If there is time, family members should ideally be encouraged to visit with the patient before the medication is given if they would like to see him or her awake one last time. Once the care team and family have determined that the patient is completely comfortable, the patient can then be removed from the ventilator and other life support therapies. Families can stay in the room when the ventilator is removed, although many opt to stand in the hallway during this process as there may be phlegm or bodily fluids present at this time and the sound of suctioning. After this, the family can gather around their loved one, touch them, play music, pray, talk, eat. If the patient looks uncomfortable, medication will continue to be given until they look peaceful. The medication given is not lethal, but it can speed up the dying process as it suppresses the respiratory drive. However, this is not considered unethical. Death ultimately results from the disease process, the reason the person was in the hospital in the first place, not from the medications. The amount of time it takes for a person to pass away is not always predictable. However, death does occur faster with a lower blood oxygen level. Patients who continue to breathe and have normal oxygen levels after the ventilator is removed may have days to live. Patients who do not breathe or who breathe poorly and have low oxygen level may only have hours or minutes to live. Many families often request that some oxygen be given to the patient. While this can be provided, if the person has been given enough medication, they will not need it as they will not feel any air hunger. More often than not, the use of oxygen at this point is to make the family comfortable, not to make the patient comfortable. Putting oxygen on a patient at this juncture may keep the person alive longer, but it also may prolong the dying process. Some patients are quiet at this time, while others may make sounds like a snoring or a rattling in the chest that can upset family members. Suctioning, repositioning the patient, or using atropine drops in the mouth are ways your healthcare team can try to suppress the breathing sounds, although ultimately it may not be possible. Care will be provided to the patient on an as-needed basis. They may receive frequent oral care. They may be repositioned with pillows from time to time. If the patient had a catheter before life support was removed, it will remain in place to eliminate the possibility of them wetting on themselves. The amount of personal care given to the patients can be increased or decreased based on family preferences. All other aspects of medical therapy are stopped at this time. We no longer draw labs or check blood sugars. We stop antibiotics, cardiac medications, and dialysis. Again, we are focusing on comfort at this point, and many of these therapies are considered invasive, uncomfortable, and may prolong suffering during the dying process. Usually the patient remains on the cardiac monitor, which is displayed at the bedside. It can be turned off during this process, but most families elect to keep it on as it allows them to see their loved one's heart rate and oxygen level. As the vital signs weaken, the monitor may beep or alarm. These alarms can in most cases be disabled, as they can be distressing. A person can pass away and still exhibit a heart rhythm on the monitor. This phenomenon is known as PEA, or pulseless electrical activity. During PEA, the heart is still conducting electricity that the monitor can pick up and display, although the heart itself is not beating. Similarly, patients with pacemakers will show electrical activity on the screen, but the heart will not be responding to the pacemaker. When the loved one passes away, they do look different. There is a subtle but noticeable change in the person's skin color. There is a drop in temperature of their skin as well. The person's mouth may remain open, but that is not always the case. The mouth tends to stay in the position it was in when they died. If it was open to accommodate a ventilator or a BiPAP mask, it will likely stay that way. A towel can be rolled up and put under the chin to assist the mouth to close, although this may not always help. Staff members can assist families in making the person look presentable in any way possible. Cleaning their face, combing their hair, fixing their bed sheets, closing their eyes. This is done to make the loved one look as peaceful as possible for family members who are still on their way to the hospital or to those coming into the room from the waiting area. Families can stay with their loved one as long as they need after they pass away. We allow families as much grieving time as they need. Being in the room after the person has passed can be an incredibly healing and meaningful experience for loved ones, providing closure and release. After life support is removed, every death experience is different. They can range from peaceful to traumatizing depending on the circumstances. This video outlined a general experience. If this is happening to you right now, I'm so very sorry. My advice: as your nurse, keep me in the loop at all times. Let me know your needs and I will do my best to accommodate them. Both you and your loved one are still my patients, and it's my job to care for you. I will be outside the room for much of this process to give you and your family privacy, but I still want you to have the best experience possible. So tell me what I can do for you. I've been through this too.